Hello everyone, welcome back to this channel. In today's video, I will discuss about these emergency drugs and their uses. This will be part one of the videos. So in this video, I will discuss three of these emergency drugs, that is adrenaline, atropine, and noradrenaline. So the first one is injection adrenaline. Ad Adrenaline is a non-selective alpha or and beta agonist indicated for treatment of type 1 allergic reaction, including anaphylactic reactions in patient in asystole. That means when the ECG is flat, as a metastasis during intraocular surgery, and in hypotension associated with septic shocks. Adrenaline it is also called epinephrine. It comes in two dosage form or concentration form, which is 1:1000, which is equivalent to 1 mg per ml, and the other form is 1:10,000, that is equivalent to 0.1 mg per ml. So the mode of action, it stimulates alpha and beta and beta 2 adrenergic receptors, resulting in the relaxation of smooth muscles of the bronchial tree, cardiac stimulations, and dilations of the skeletal muscles vasculature. And if we give in small doses, it leads to vasodilations, and in large doses, it leads to vasoconstrictions of smooth and skeletal muscles. The users first use it, they use in case of asystole, in case of pulseless electrical activity, ventricular tachycardia, or in ventricular fibrillations. Here in this case, it is given in IV or sometimes intraosseous. They give 1 mg, that is they use the concentration of 0.1 mg per ml solutions every 3 to 5 minutes until there is a return of spontaneous circulations. And in case if there is no IV access, or it's not, or it can be given through intraosseous, so they usually give in double the dose of IV IV dose through endotracheal tube. So when we give through endotracheal, so we have to give 2 to 2.5 mg every 3 to 5 minutes until we have an IV access, or we can give through intraosseous. Second uses in case of bradycardia, if the heart rate of patient does not improve with atropine, so here we give through IV infusion at 0.1 microgram to 0.5 micrograms per kg per minute. That is, suppose this is there, for example, in case of 70 patient kg, 70 kg patients, the dose will be 7 to 35 micrograms per minute. So here we give through infusion, and then after starting infusion, we can titrate it accordingly to our according to the patient response. We can titrate the dose, whether we can increase the dose or we can decrease the rate of infusion. The third one is for hypersensitivity reactions or anaphylactic. Here we give through endotracheal tube in case there is no IV access, or we cannot give through intraosseous and all. So here the dose also will be 2 to 2.5 mg every 3 to 5 minutes until we have IV access, or we can give through intraosseous, and we can also give through IM route. So here we give 0.2 to 0.5 mg or 0.01 mg per kg. If we give it according to the weight of the patient, the dose will be 0.01 mg per kg. The maximum dose will be 0.5 mg. That is, in case of patient of 50 kg, we can give 0.5 mg using the 1 mg per ml solution. That is the concentration level, which is 1:1000 solution. Then we can repeat it every 5 to 15 minutes if there is no improvement in the patients, and also we can start as IV infusion if the patient is not responding to IM injections. And number 4, self-administration following severe allergic reaction, example insect stings or insect bites. Here the adrenaline came in the form of auto-injector, and usually give through IM or subcutaneous, and the dose is 0.15 mg, which comes in the amount of 0.15 ml or 0.3 mg, and the quantity or the amount 0.3 ml. And if the weight of the patient is more than 30 kg, then we can administer 0.3 mg, that is 0.3 ml. And if the symptoms of patient persist, then we can repeat the injection by using another auto injector. And number 5 is the inotropic support. This adrenaline we can use as a inotropic support also by uh, giving through IV infusion or continuous IV infusion, and the dose is 0.01 ml microgram to 0.5 microgram per kg per minute. And suppose in case of patient of 70 kg patient, that is the dose will come to around 0.7 micrograms to 35 micrograms per minute, and then we can titrate accordingly to get the effect. Suppose a patient BP is low, so we can increase the dose up to 35 micrograms per minute, and if the patient's response, then we can titrate it down, so we can decrease the dose of adrenaline gradually. And number 6, shock or hypotension. In case of cardiogenic shock or post cardiac arrest, we give the through IV infusions. Dosage is like I have told previously, 0.01 to 0.5 micrograms per kg per minute. And in case of septic shock, usually we give along with noradrenaline. Not in case of septic shocks, noradrenaline is the first preferred vasopressors for septic shocks, and in case of septic shocks, we use as adjunctive agent. So the dose is 0.01 to 0.7 micrograms per kg per minute. And number 7 is in case of acute asthma, which is not responding to nebulization, then we can give through IM or subcutaneous, and the dose is 0.01 mg per kg in 3 divide doses. Now the second one is injection atropine. Injection atropine is a muscarinic antagonist and is used in pre-operative or as a pre-anesthetic agent to inhibit saliva or secretions. It also used for treatment of symptomatic bradycardia or in case of some GI conditions like non-ulcer dyspepsia or irritable bowel syndromes. And also is used in treatment of mushroom poisonings. Atropine is used as an adjuvant during neuromuscular blockage to manage bradycardia. Sometimes when they do this neuromuscular block, sometimes patient goes into bradycardia. So to manage that, they give atropine, and it is also an antidote for organophosphate poisonings. And the mode of action, it blocks the action of acetylcholines at parasympathetic sites in smooth muscles and secretory glands and the CNS. And the first use is inhibition of saliva or secretions. It is usually given before anesthesia through IM or IV or subcutaneous route, and the dose is 0.5 to 1 mg, and is given 30 to 60 minutes before anesthesia, and it can also be repeated every 4 to 6 hours in case it is needed. And the second uses is symptomatic bradycardia, and the route of administration is IV or IM, and the dose is 0.5 to 1 mg every 3 to 5 minutes, and the maximum dose is 3 mg. And in case there is no IV access or we cannot give through IM or intraosseous, so we can give through endotracheal, and the dose is twice the dose of IV, that is 1 to 2 mg every 3 to 5 minutes. And here we have to know one thing about atropine. In atropine, the 1 vial of atropine, it contains 0.6 mg per ml. That is 1 vial, it contains 1 ml, and the dose is 0.6 mg. So here the maximum dose or we can give is 3 mg, that is 5 ampoules. And the third one is mushroom poisonings, and the route of administration is through IV, that is 1 to 2 mg given IV, and it can also be repeated as as needed. Number 4 is bradycardia during neuromuscular blockage, and the dose is given 15 to 20 micrograms per kg and is given through IV. Number 5, in case of organophosphate or carbamide poisonings, in case of mild to moderate symptoms, usually they give through bolus, IV bolus, and the dose is 1:2 mg and can be repeated by doubling the dose every 3 to 5 minutes. That is, suppose if the patient is given 1 mg and after 3 to 5 minutes, we can, if the patient does not improve, we can repeat it to, we can give 2 mg bolus after 3 to 5 minutes, and once the patients start responding, then we can we can change this bolus to IV continuous infusions, and the dose is usually 10 to 20% of the total cumulative IV bolus doses. Suppose we give IV bolus 18 mg, and 10% of that 18 mg will be 1.8 mg. So we have to start IV infusion 1.8 mg per hour. So in case of severe symptoms, the initial dose is 3 to 5 mg, and in this case also, suppose we give the patient in severe symptoms, we give the patient 3 mg. So after 3 minutes or 5 minutes, we can give 6 mg another bolus to the patients if the condition is not improved, and if the patients start responding, then here also we can change to IV infusion, and here the dose also is same. We have to give 10 to 20% of the total bolus given. That it's same like, suppose if the total bolus given is 18 mg, so 10% of 18 mg is 1.8, so we have to give 1.8 mg per hour. Now come to noradrenaline. Noradrenaline it is also called norepinephrine. It's anorganic chemicals in the family of catecholamine, and it functions in the brains and body as hormones and neurotransmitters. It functions as a peripheral vasoconstrictor, and it is used in case of emergency, like in acute hypotension. Mode of action is stimulates beta-1 adrenergic receptors and alpha adrenergic receptors, causing in the increase of contractibility and increase the heart rate, and also cause vasoconstriction, and thereby increase the blood pressure. And the uses of noradrenaline, they use in case of hypotension or in case of shocks, and this noradrenaline, it is given through IV infusion, and the dose is 8 to 12 micrograms per minute in case of hypotension and shocks, and in case of post cardiac arrest, the dose is 0.1 to 0.5 micrograms per kg per minute. So in case, suppose a patient is 70 kg, so the dose will come to 7 to 35 micrograms per minute, and in case of cardiogenic shocks, the dose is 0.05 to 0.4 micrograms per kg per minute. That will come to 3.5 to 28 micrograms per minute in case of 70 kg patients. And number 4, sepsis and septic shocks. So in case of sepsis and septic shocks, the dose is 0.01 to 3 micrograms per kg per minute. That is 0.7 to 210 micrograms per minute in case of 70 kg patients.